neurodynamic test for the median nerve, if someone's got problems abducting the shoulder, which is a very common situation if you're actually testing for a nerve, is to stand this time, instead of standing facing their head, this time you're facing their feet. And you put them, instead of having them straight in the couch by the side of the couch, you put them diagonally across the couch and try and get their elbow off the edge of the couch without their head actually hanging off the end. And just try and straighten the head up a wee bit like that. So you've got them all nice and straight in a diagonal with their shoulder off the couch. No pillow again, you never use a pillow with any of these tests. And what you do is you use this nearer thigh rather, to push the shoulder down. So that's your shoulder depression as we had last time. And the grip this time, instead of being a pistol grip, is just use the whole of your hand or the whole of their hand, but make sure, remember the median nerve is coming into these first, second and third fingers, so these are the ones that you're going to want to extend backwards. So use your hand to make sure that it pushes the thumb, second and third fingers away, or is able to do that, but we don't do that yet. I'm going to hold their elbow, support their elbow with the nearer hand. So there's our starting position. So I've got my thigh pushing the shoulder down, we've got our hand holding securely onto the thumb, second and third fingers, ready to be able to extend them. The elbow in flexion at the moment, and now to extend that median nerve, the first thing this time we do is elbow extension. We then do lateral rotation, supination, wrist and finger extension, and that will probably be enough. Remember, these people have already got a problem, they can't abduct their shoulder, but if we need to, and if they can, you can always add a little bit of abduction there. And then the normal final point, we ask them to side bend their head away, and I can actually feel that tension coming in there, and that's our full extension, or full stretch of the nerve. Now, the differential diagnosis, i.e. is it nerve or is it muscle, we ask them to bring their head back to the neutral. Does the pain get less? Does it go away? If it does, then it's nerve. If it doesn't, it's muscle. We've decided it is nerve because it's got less or it's gone away. So, the easy starting position for the sliding, put it into the full way. There's where it's full. Shorten it a little bit by bringing it back. And then as Maggie takes her head to the left, I take a bit of pressure off here. Keep the nerve the same length, and we slide it back and forwards. So I'm taking the pressure off the wrist as she brings her head back and forwards, and that's keeping that nerve at the same length, and it's sliding it backwards and forwards and untethering it. And that's the second median nerve test.